Sir Christopher Chope.
Mr Deputy Speaker, may I first of all thank Mr Speaker for granting this debate, which I think is the first such debate on the 1979 Vaccine Payments Act since the 24th of March 2015. Vaccines have been our major public health defence against Covid-19, and this debate is not about all those millions of people who've benefited from vaccination. It's about the tens of thousands who did the right thing, were vaccinated, but then, as a result, suffered death, serious injury, or other life-changing adverse consequences. The Vaccine Damage Payment Scheme was extended to cover Covid-19 vaccinations in recognition of the potential importance of this issue. And I'm delighted that the Prime Minister also clearly believes it is an important issue. On the 11th of August last year, he wrote to Kate Scott, whose husband Jamie, a fit 44-year-old software engineer, spent 124 days in hospital following severe brain injury caused by the vaccine. The Prime Minister said, referring to Kate's husband Jamie and his family from Warwickshire, "You're not a statistic and must not be ignored." The Prime Minister went on to thank Kate Scott for her suggested changes to the Vaccine Damage Payment Scheme and promised that the government would consider the case for reform. Why then, Mr Deputy Speaker, is there no tangible evidence of the government having done anything in the 6 months since the Prime Minister said those words? It has repeatedly blocked my Covid-19 vaccine damage bill, which was briefly debated in this House on the 10th of September. Why has the government not even uprated the £120,000 payment under the scheme to take account of inflation since 2007, when it was last reviewed? On this basis, the maximum should now be over £177,000. Why have no payments yet been made under the scheme, even where a full inquest has established that the vaccine was the cause of death? That, sadly, is the situation of Lisa Shaw's family. The 44-year-old BBC Radio Newcastle presenter died from a brain hemorrhage confirmed by a coroner in August as having been caused by the AstraZeneca vaccine, as reported in the Sunday Telegraph on the 5th of December 2021. Another case about which somebody has written to me arose from a decision by the Westminster coroner, who recorded the AstraZeneca vaccine as the cause of death on her mother's death certificate. Neither of these families is yet to receive any acknowledgement that they qualify under the VDPS, let alone that they will be compensated. Is the government disputing these coroners' verdicts, Mr Deputy Speaker? I sincerely hope not, and perhaps the Minister can confirm that in her response. The Sunday Times reported on the 27th of February this year that 920 coronavirus vaccination injury claims had been registered, but none has been accepted nor been the subject of any payment. That article referred to Zion Spit, described as a ridiculously healthy 48-year-old antique dealer from Cumbria, whose death was confirmed as having been caused by the vaccine. His partner of 21 years and his fiancée, Vicky Spit, has been in touch with me to express her solidarity with my efforts to obtain redress from the government and her frustration at the government's refusal to engage with victims and their families. Well, can I just make one more point? Please will the Minister tell us now when the first payments will be made under the VDPS, and why, despite having told me that 26 staff are now processing claims, 11 more than in December, no payments have yet been made? Will she also say how many medical assessors are currently reviewing outstanding cases and when the backlog will be cleared? I happily give way.
Mr Deputy Speaker, can I first of all congratulate the Honourable Gentleman for Christchurch for bringing this forward. He's been a doughty campaigner on this issue, and we all recognise that and wish him well. Does the Honourable Member not agree that whilst it is right and proper that we have confidence in the vaccines, those of us who have taken the vaccine, the two doses and then the extra one as well, that there are undoubtedly occasions, as he's outlined, when things go wrong, and these occasions should be appropriately compensated. And I believe that there is a duty of care upon government and upon the minister, and there's also, I believe, a moral obligation to stand up and stand out for those people, and that this must move in line, when it comes to being appropriately compensated, this must move in line with the times and the very costs, not of the loss alone, but a compensation cost of dealing with these consequences.
Mr Deputy Speaker, I agree absolutely with the honourable gentleman, and I'm going to describe him as a veteran of this issue, because he was one of the honourable members who actually participated in the debate in 2015 to which I referred. Can I just say this, that many of those who've written to me have indicated that even a payment of £177,000 would be totally inadequate for the injuries and financial losses which they've suffered, including loss of earnings and the cost of care. The range of adverse conditions caused by the vaccines is extensive. By way of example, Mr. Julian Goody of Henley has given me permission to disclose his circumstances because of his frustration at the lack of understanding by the government. 2 weeks after receiving his vaccine, Mr. Goody experienced acute pain throughout his body. He developed Bell's palsy, required treatment for his left eye which would not close, suffered bowel incontinence and severe fatigue. Peripheral numbness and pain in his upper legs, feet, neck and hands then developed. He was in and out of the accident and emergency department at the John Radcliffe Hospital for 2 weeks, being prescribed steroids, painkillers and undertaking multiple MRI and CT scans, electromyographs and nerve conduction studies. He then, Mr Deputy Speaker, collapsed at home in pain and was admitted as an inpatient for 5 days of intravenous immunoglobulin in an effort to halt the continuing nerve damage caused by the autoimmune response to the vaccine. He was then diagnosed with Guillain-Barré syndrome, which is an autoimmune disease in which the body attacks its own myelin sheath. Does my honourable friend, having listened to those circumstances of Mr Goody, believe that his case meets the 60% disablement threshold? And can I say to my honourable friend that I have received so many other reports of complicated symptoms which have been a real nightmare for our hard-working NHS to address, and for which there is in many cases no cure whatsoever. I happily give way.
Very grateful, Chairman, for giving way. This is, as we can tell from the very distressing stories that he's telling, a very important debate, and I regret the empty chamber on this occasion. The honourable gentleman is a brave member of this House. He speaks his own mind in defiance of conventional wisdom. Does he agree that the same goes for a large number of doctors and scientists who are also defying conventional wisdom to raise concerns about the safety and efficacy of the vaccines, particularly when it comes to vaccination of children, which the government is now encouraging? And does he agree with me the government should be as transparent and open as possible about the risks and about the safety and efficacy of these vaccines?
Absolutely, and I've been in correspondence with constituents who work at Royal Bournemouth Hospital and Poole Hospital who've expressed their concerns. And one of the reasons why a lot of people with medical expertise are worried about this is because they have seen these examples in their own work. And my honourable friend refers to the issue of encouraging more child vaccines to be administered. But if we're going to do that, then surely we should be able to give the parents of those children the secure knowledge that if, against everybody's expectations, those vaccines turn out to have dire consequences, life-changing consequences that may last for 40 or 50 or longer years, it's important that those parents who are thinking about this should appreciate the risk, but also know that if something goes wrong, the government's on their side. And at the moment, there is no evidence, I'm afraid, that the government is on the side of these hapless victims of vaccine damage. In recent months, I've received hundreds of emails reporting deaths and serious illnesses involving immune thrombocytopenic purpura, which causes the number of blood platelets to be reduced. On the 10th of January, in question 100420, I asked the Minister what was being done to investigate the 427 suspected cases of this, and if the government would make it its policy to inform those affected of the availability of the vaccine damage payment scheme. Following my point of order yesterday, Mr Deputy Speaker, complaining about the government's failure to respond to my questions, I did receive a response from the Minister yesterday evening, which stated that following a scientific assessment of all the available data and a review by the Commission on Human Medicine's Covid-19 Vaccines Benefit Risk Expert Working Group, it was determined that an association between the AstraZeneca Covid-19 vaccine and TTS, thrombosis with thrombocytopenia syndrome, was likely. I hope the Minister will unravel the jargon in that answer and confirm in simple terms that what this means, that in the cases to which I'm referring, causation has now been established and that there should be no bar to the compensation scheme coming into effect. Will the Minister also answer that part of my question which related to whether the government will notify those 427 families affected by this particular aspect of the availability of the VDPS? Surely that would be the most basic, humane response. Why hasn't the government responded at all to that? This is making me, as I think you can probably tell, Mr Deputy Speaker, angry. I had 5 other name-day questions to which I referred in my point of order as having not been answered, and they remain unanswered. Will the Minister apologise and explain? Many correspondents from constituencies across the United Kingdom remain sceptical as to whether they will be able to qualify under the VDPS. This issue has all hallmarks of becoming a bureaucratic nightmare for victims and their families. Why should the government be forcing these people to go through the ordeal and delay of having to seek expensive legal help instead of enabling their representatives in Parliament to be given the information necessary to establish their claims? And that's why these parliamentary questions and this debate are relevant, because it will enable our constituents to be able to establish their claims without having to go to law. The scale of this vaccine nightmare is now such that the number of vaccine damage cases exceeds all cases arising from previous vaccine programmes. In answer to question 92799, the Minister confirmed that as at the 15th of December last year, the Medicine and Healthcare Products Regulatory Agency had received and analysed a total of 410,232 yellow card reports, 145,446 from people who received the Pfizer-BioNTech vaccine, 240,065 from those who received the AstraZeneca vaccine, and 24,721 from those who received the Moderna vaccine. The patients were reported to have, some patients were reported to have died shortly after vaccination, 666 in the case of Pfizer reports, 1,164 in the AstraZeneca reports, and 23 in the Moderna reports. So people are dying from this vaccine. Not many, well, actually, quite a large number. Far more than we see in tragedies which detain this House for hours on end. Quite rightly. But I think this is a tragedy which demands the attention of the House and the Minister. As not all those who died shortly after vaccination would have died because of the vaccine, I thought it was fair to ask a further question as to the number of such cases where the yellow card analysis showed that the death would have happened regardless of the vaccine or medicine being administered. I asked this question to help promote vaccine confidence and to prevent inaccurate conclusions being reached. Much to my disappointment and dismay, however, that question hasn't been answered in a timely fashion or at all. Why not, one asks? Surely the government must have this information, and its failure to produce it can only help further raise suspicions of a lack of transparency. The government almost seems to be in denial about all this. The reluctance of the government to provide timely information is further exemplified by the delay in updating the information provided as at the 15th of December. Almost 3 months have elapsed since then, and the government has ducked my further question about sharing the results of the MHRA analysis of yellow cards with the patients in respect of whom the yellow cards were received. And since the last report, we've had a mass of booster vaccines, and people have written to me saying that they have suffered dire consequences. Some people have suffered dire consequences as a result. I expect, Mr. Deputy Speaker, that in her response, the Minister will point out that the vaccine damage scheme does not preclude individuals from bringing claims against the manufacturers for product liability. We know, however, that the government decided to indemnify and thereby exclude manufacturers from potential liability, but we don't know the terms. In her answer to question 92800 of the 14th of February, the Minister said that her department is providing indemnities in the unexpected event of any adverse reactions that could not have been foreseen through the robust checks and procedures put in place. She said, however, that she was unable to provide information about the terms of those contracts between the government and vaccine manufacturers, as they are commercially sensitive. In those circumstances, should those who have suffered adverse reactions that could not have been foreseen through the robust checks and procedures put in place, should they be making claims against the government or the manufacturers, or both? I hope the Minister is listening to this question, because it's in the public interest that my honourable friend gives a definitive answer, because people are champing at the bit, wondering whether they need to make claims against the manufacturers, against the government, or whether they can rely upon the VDPS. In introducing the vaccine damage payment legislation in 1978, the then Secretary of State for Social Services, David Ennals, referred to the humane motivation of that legislation and said, "It's important since its aim is to provide a measure of financial support to people severely disabled as a result of vaccination and to their families and others involved in looking after them. There can be no doubt that those concerned pay a high price in terms of personal disablement and that their families share in that price. For most people, vaccination is a beneficial procedure, and it is right for the community to give financial aid and support to those who suffer as a result of vaccinations given as part of the public policy programme." That's what he said all those years ago. Those sentiments remain as relevant today as ever, and I hope that as a result of this debate, the government will, through its actions, show that it shares those sentiments. As the Prime Minister said, the victims of COVID-19 vaccine damage are not statistics and must not be ignored, not for any longer. Anyway.
Minister.
Thank you, Mr. Deputy Speaker. Can I start by just thanking the honourable gentleman for bringing this debate to the floor of the House this evening. It is an important debate and one that asks some very important questions as well. Vaccinations are an effective health intervention which can save lives and promote good health, and we have one of the best immunisation programmes in the world, and we're at the forefront of rolling out new initiatives. And I'm very proud that a key factor of getting us through the COVID pandemic has been the vaccine programme. However, as my honourable friend points out, there are extremely rare circumstances where individuals have very sadly experienced severe disablement with a possible link to the vaccine. Now, the VDPS that we're debating today is one of the many ways that the government supports individuals and their families where that has happened. And it recognises that vaccines themselves remain the best way to protect us, particularly against COVID. And people have done the right thing by coming forward and having the vaccine. I want to reassure people today that the vaccine is safe, and we are still encouraging people to have their vaccination done. But I do recognise that some people have had experiences from the vaccine that we need to address, and my honourable friend is asking very important questions. I will give way.
I know she's about to go into the types of support available, so I just thought I'd make my pitch at this point, which is I have a wonderful 38-year-old female constituent, mother of 3. After her first shot of AstraZeneca, she has had horrendous life-limiting conditions. The NHS seems to have closed its doors to her. For 10 months she's been asking for help. No one will give it. She's had to go to Germany to get the specialist blood analysis that she needs. So could the Minister kindly include what medical ongoing support and pathways the NHS has created within this support specifically to make sure that people like my constituent get the help they so desperately need to live healthier, happier lives?
Absolutely.
I thank my honourable friend. If she wants to contact me after the debate this afternoon, I'm very happy to find out what specific help is available for her constituent in the local area. But we do have a robust safety mechanism in place dealing not just with COVID vaccines but with all medicines. And the VDPS was established in 1979 to provide a one-off tax-free payment with the aim of easing the financial burden for those individuals who on rare occasions that vaccination causes severe disablement. And for this specific vaccine, or these specific groups of vaccines that are COVID-related, the Prime Minister announced on the 21st of September that responsibility for the VDPS transferred from the Department of Work and Pensions to us in the Department of Health and Social Care on the 1st of November 2021. And so we are picking up that mantle and are working at pace to address the many issues that my honourable friend has raised. I will very quickly, because I don't have much time.
Very quickly, Minister, thank the Minister for that. Will the compensation scheme that the Minister referred to there, does that apply right across the whole of the United Kingdom of Great Britain and Northern Ireland? In other words, does Northern Ireland people qualify, Scotland and Wales, if they have the same ailments that the honourable gentleman, the honourable lady, has referred to?
My understanding is that it does, but I will clarify that for the honourable gentleman. I don't want to inadvertently mislead the House if I've got that wrong, but my understanding is that it does. So the NHS BCA, which has taken over this process, are looking to improve the claimant journey on the scheme through increasing personalised engagement, reducing response times, which is one of the points that my honourable friend has made. And the difficulty we have with the Covid-19 range of vaccines is they are new and we are still learning about them, and the scientific evidence on potential causal links between the vaccine and incidences of disablement is still being developed, and that is part of the delay in some of the claimants still not having their claims addressed.
Will my honourable friend give way?
I will.
I'm very grateful. She's not going to have time to answer all my questions, so would she agree to meet me to discuss the issues I've raised, which she won't be able to deal with in her response? And just on this issue of evidence, does she require more evidence than a coroner's verdict in order to enable the relatives of somebody who died following the vaccine to be able to get compensation?
So the process is a difficult one, and the ruling in terms of causal link between a medicine and an adverse event, and whether that's led to death or to injury, is made by the MHRA, and there is a process that has to be followed, and it's an independent process of government, and that process has started on these range of vaccines, and it remains vital that decisions are made on the evidence that's presented, and currently the process is that they are going through patients' notes that have been affected, gathering that evidence and looking for causal links. If these were vaccines that were maybe 5, 6, 7 years old, we'd be in a very different place. But I can say to the honourable gentleman that as of the 18th of February this year, there have been 920 claims to the vaccine damage payment scheme related to COVID-19. And the work that's going on at the moment is establishing, is there a causal link between the vaccine and the adverse events that these people have been suffering. The yellow card scheme does help us gather information, and we do that for all medicines. And I would encourage people, whatever symptoms they've had, whether they're severe or they feel they're minor, do report in, because that's how we gather evidence on these medicines. Now, for all those claimants who have claimed to the VDPS in relation to COVID-19, while we're gathering evidence from their medical records, the approach is that we will look at the assessment criteria and make sure we're in the strongest possible position before we put the evidence to the medical examiner. This in turn will help ensure that claims are assessed as quickly as possible, and that roughly what we think will take around 6 months. And I will certainly meet with the honourable gentleman and make sure that we hold people's feet to the fire, that there isn't a longer claim or a longer delay than needed. So the NHS BSA are working as quickly as possible to progress claims as soon as possible, and my understanding is they have been in touch with claimants to update them on progress, and will continue to update them once they have news on that. So we estimate that the current process will take around 6 months on average. It does require gaining access to people's medical notes, their previous medical history, because while someone may have had a reaction on the day, we cannot say for sure until we've looked at all the evidence that that is a causal link between the vaccine and the adverse event, even though there may be a strong suggestion that it is. So it's important that we follow that process correctly. He touched on the payments. The original payment was set up at £10,000 in 1979. It's currently £120,000 at the moment. And we haven't made any payments in relation to the COVID vaccine, but we are working at pace through all those applications to the programme. And once a causal link in those cases has been established, then we can look at those claims more swiftly. What I'd also... I will.
I'm grateful. I'm very grateful to her for agreeing to have a meeting to discuss the further issues she can't cover tonight. But just on this issue of the 120,000, that hasn't been increased since 2007. It's now effectively would be worth £177,000. Why won't the government just give in on that point? That would be a great victory tonight for a little bit.
Well, I'm not going to commit tonight to increasing the payments. I think that's above my pay grade, but perhaps when we meet, we can discuss that further. But I do want to reassure people who are watching this debate and right honourable colleagues that the safety of the COVID vaccine, the benefits of taking the vaccine, do outweigh any adverse events that may be caused. And with any medicine, even the simple paracetamol, if you look at the yellow forms that are collected for that, if you look at the side effects in the leaflet that comes with a packet, there are always side effects with every medicine. And we want to reassure people that the vaccine is still a safe and effective way of protecting people and their loved ones from the virus. But when there have been concerns, we need to identify causal links, and if causal links are established, we need to ensure that those, as the Honourable Lady from Melton Mowbray is pointed out, we need to be better at supporting them, and that's very much something that I'm very keen to do. These are new vaccines in terms of medicine lifespans. Although they've been with us for nearly 2 years, they are very new, and we are learning about them still, both in their efficacy, but also in terms of their side effect profile as well. And each vaccine is assessed by a team of scientists and clinicians on a case-by-case basis. So, in summary, Mr. Deputy Speaker, we are acting at pace, although that can feel a long time if you're someone who's been affected by side effects. I will meet with the Honourable Gentleman to discuss this further, and I'm keen to get support and payment in place for those affected if we can do as quickly as possible.
The question is that this House do now adjourn. As many of them say aye. You know, I think the ayes have it. The ayes have it. Order. Order.
The proceeding has ended. The proceeding has ended. The proceeding has ended. The proceeding has ended. The proceeding has ended.